Hello all, welcome back to my channel. This is once again Dr. Sonam Sakutti. Today I will be dealing with the continuation of my previous video, which was about the antimicrobial therapy in dentistry. So as usual, if you are new here, please don't forget to subscribe my channel, like this video and share this video to those in need. And also don't forget to press the bell icon so you will be notified about my upcoming videos. So let's continue with the topic. The common groups of antibiotics that we use include beta-lactam antibiotics, which include penicillin, synthetic groups of penicillin, and cephalosporins, tetracyclines, erythromycin, sulfonamides, and trimethoprim. Quinolones and some of the antiviral drugs like acyclovir, gentamicin, and some antimycotic drugs like polyenes and azole types of antifungal agents. So let's get into one by one. The first one is the penicillin. As I mentioned in my previous video, the penicillin acts by inhibiting the cell wall synthesis of susceptible bacteria. The penicillins are of two types, the naturally occurring ones and the semi-synthetic ones. The semi-synthetic penicillins include ampicillin, amoxicillin, and so on. Now, we can deal with the combination drug, that is amoxicillin with clavulanic acid. This is commonly available in the market as Moxclav or Augmentin. The composition of this combination drug include amoxicillin, which is 500 mg, and clavulanic acid, which is 125 mg, together forming 625 mg. Now, what is actually the use of this combination drug? Combination will result in broadening of the antibacterial spectrum of amoxicillin to include organisms that are resistant to amoxicillin because of their beta-lactamase production, like species of Staphylococcus and some gram-negative bacteria like E. coli. Next, we can discuss about the other group of antibiotics, which include the cephalosporins. Cephalosporins are similar to the penicillin but have a different source. These are commonly indicated where penicillins are contraindicated. The cephalosporins may be first, second, and third generation, based on the general features of the spectrum of activity. Some of the commonly used cephalosporins include cefazolin, cephalexin, ceftriaxone, etc. Next is a tetracycline. They are classified broadly as naturally occurring like tetracycline, chlortetracycline, oxytetracyclines, and semi-synthetics like doxycycline, minocycline, and meclocycline, etc. It is important to understand about the mechanism of resistance when dealing with the tetracyclines. There are three types of tetracycline resistance: tetracycline efflux, ribosomal protection, tetracycline modification. Some of the important contraindications of tetracycline include: it is strongly not given during infancy and childhood of 8 years of age due to the fact of staining the developing teeth due to the formation of stable chelicate complexes which are formed with metals including calcium and magnesium. The second contraindication is that they are not given with milk, yogurt, and other dairy products as they get inactivated by the presence of calcium in them. The third contraindication is that they should be avoided during pregnancy and in lactating mothers. Tetracyclines are the most common antibiotics responsible for causing superinfection because they cause marked suppression of normal intestinal flora. Next antibiotic that we are going to discuss is the erythromycin. Erythromycin is a principal member of macrolide group of antibiotics. Its use is strongly contraindicated with warfarin, carbamazepine, and other oral contraceptives. So then comes to an end to the brief description of antibacterial agents. Now we can go through the antimycotic agents. The common antimycotic agents or the antifungal drugs include polyenes, which contain amphotericin B and nystatin, and azole antifungal agents, which include imidazoles and triazoles, which includes the cotrimazole, iconazole, fluconazole, and so on. So let's go into the detail of antifungal agents. Normally, we use the amphotericin B and nystatin for the treatment of oral candidiasis. They act by inhibiting the candidial growth through an interaction with ergosterol. Nystatin is most commonly used for treating the superficial infections of Candida albicans. The drug nystatin is available in the form of creams, tablets, suspensions, oral rinses, and gels. Ointment is used for the treatment of angular cheilitis and tablets are used for the oral candidiasis. Suspensions of nystatin is used for young children and non-compliant patients. Oral rinses are relatively ineffective because of the short contact time with these. So now, when coming into the azole group of antifungal agents, clotrimazole is an imidazole which is primarily a fungistatic with a broad spectrum of activity. It is mainly used for superficial infections of the oral cavity, skin and vagina which is caused by Candida species. Ketoconazole is commonly indicated in secondary oral candidiasis such as chronic mucocutaneous candidiasis. Miconazole is useful in the treatment of angular cheilitis and treatment of Candida associated with dengue stomatitis. So that comes to an end to the topic antimicrobial therapy in dentistry. Stay tuned for much more videos from me. Till then, it's Dr. Sonia Musakutti signing off. Thank you.